Good day. My name is Moses Adejo Simeon, a 100-level healthcare management and nursing student of JPTS of Science and Technology Institute in collaboration with South American University USA, Pan American College in California, and Global World University Togo. I'm here to present a brief seminar on a term, the presence of hepatitis B envelope antibody in a patient who have been previously screened for surface antigen. Now, what is hepatitis? In this, we shall be talking about hepatitis B because we have different types of hepatitis A, hepatitis B, C, and D, E. But when we talk about hepatitis B is an inflammation of the tissue of the liver. It means there is a physical localized condition whereby there is a swelling or there is a reddening of the liver caused due to the presence of injury or infections. Now, hepatitis are basically caused by virus. And what is virus? Virus is an infectious agent that have a cellular organization with nucleic acid and a protein codes which lack independent metabolism but replicate on a living host. It uses chemical metabolism to keep itself alive on a living host. Now, hepatitis B is divided into two major categories, which is the early stage, which is called as acute hepatitis B, and the stage which it has developed antibodies, which is called chronic hepatitis. Now, chronic hepatitis has killed a lot of people in the worldwide, and it has damaged a lot of people in Africa as a whole. But in this stage, the early stage. The early stage is about 2 to 3 weeks. It can be eradicated by receiving a lot of rest, taking a lot of rest, having a diet food, or taking excess of fluid. It will totally eradicate. But if it has lasted to 4-6 months and it has built up antibodies, which is called by the presence of antigen, and this is a protein that produces a signs or that produce antibodies in the presence of infections. Now, if it has lasted, this is how it will come about cirrhosis, hepatocellular carcinoma. And in this stage, it cannot totally be eradicated. It can only be diagnosed, or you can only be on life treatment for the rest of your life. Hepatitis B, it is being tested through the three following categories I might not explain due to the factor of time. Now, it can be tested by blood test, it can be tested by abdominal ultrasound, it can be tested by liver biopsy. Let me just talk about liver biopsy. Liver biopsy is just taking of the tissue of the liver into a lab for an experiment to be sure if you are positive or negative to this infection. Now, there are symptoms of these infections, just like you will have yellowing of the eyes or yellowing of the skin, you will have darkening urine, or you will have browning urine. Then you can have what we call constipation, you can have what we call diarrhea, and some other symptoms like abdominal pain, sharp pain in your abdomen, or stomach pain. Now, there are ways in which this disease can be contacted or spread. It can be spread through diffusion of blood. If blood is not sterilized, or if it is being diffused from an infected person to uninfected person, it is being transmitted. It can also be transmitted through unprotected sexual intercourse, which by it can contact it through the fluid which comes from the private part of the opponent. Now, it can be transmitted from a mother to an unborn baby. That is an infant. That is the early stage of the disease. Now, there are an effect of these diseases. It brought about chronic hepatitis B, which cannot be cured. It can cause liver failure. It brought about liver cancer, and it brought about cirrhosis, that is scary of the liver, and it's also brought about death. Now, prevention measure for these diseases is you abstain from unprotected sex. You should go for checkup And also you should be on a diagnosis which is known as that. Also you should go for antigen test always, which is known as immunoglobulin. That is a drugs that can help in reduce